to do interoperability. But I can't tell you how that's going to mesh.
Then if you will have someone submit to me in writing what that pathway is, this is something that is essential if we're going to be able to benefit.
In a striking departure from the hearing's combative tone, Senator Marsha Blackburn offers Robert F. Kennedy Jr. genuine praise and partnership. From ending Big Pharma's revolving door to tackling pharmacy benefit managers and overprescribing stimulants to children, the exchange showcases rare bipartisan alignment. Kennedy's warning, 1 out of every 5 kids is on these drugs. Can they deliver?
I appreciate the comments you've made about the Rural Health Transformation Program. That is something many of us worked on, and we were pleased to push that out of this committee. And I know Dr. Oz is moving forward with implementing that. I appreciate your comments to Senator Warner on the area wage index. He and I have worked on fixing that, and we appreciate your attention. I am delighted to know that you're going to end the revolving door and the conflicts of interest. I have found it so unseemly that people who work with a pharmaceutical or with a big food company then go back over into CDC or NIH or FDA, and then they're signing off on regulation for their former employer and many times their future employer. So we appreciate that. Senator Langford went to you on the PBMs. And as you are aware, my PBM Act that Senator Wyden worked with me on, that made it out of this committee last cycle. And making certain that we keep these rural pharmacies open, making certain that PBMs do not profit above what is their standard service fee, and that they have to disclose all their pricing. That is going to be an imperative. So will you work with us to get that PBM legislation across the finish line and to the president's desk?
Yes, Senator, absolutely.
Thank you. Interoperability is something that you have announced, a new interoperability framework to better align data sharing principles. And this is important to digital health. And as you're aware, when we passed 21st Century Cures in 2018, the Software Act and that health IT definition is something that I worked tirelessly on to get implemented. So what I want to hear from you is, how does CMS plan to align this new framework with the existing federal framework? And how are we going to be able to move forward with one national policy on interoperability?
Well, I don't know if we, what we have right now is concrete commitments from the 60 top tech companies who we were able to convene to do data sharing, to do patient accessibility, and to do interoperability. But I can't tell you how that's going to mesh.
Then if you will have someone submit to me in writing what that pathway is, this is something that is essential if we're going to be able to benefit from that data. So having some specificity on the pathway will be helpful. I did want to talk with you. Last time you were here, I talked about the concerns on overprescribing prescription stimulant drugs for children. And there are ways that HHS can work collaboratively with state agencies on this and to actually promote more community-based intervention to combat overprescribing. And we all have seen the harmful side effects. And there's a lot of reporting out there on this and tremendous concern for grandmamas like me who see children and friends of our grandchildren who suffer with this. So I know your team is working on solutions. So you're going to have your Make Our Children Healthy Again strategy that you're going to release. But talk for a moment We've got 30 seconds left. Talk for a moment on how you can better arm parents with information on the harmful side effects of overprescribing these stimulant drugs.
I mean, one of the problems, Senator, is that, we now have 1 out of every 5 kids on these drugs and the antidepressants, even more.
This exchange between Senator Marsha Blackburn and HHS Secretary Robert F. Kennedy Jr. stood in stark contrast to the confrontational tenor dominating most of the hearing. Rather than partisan combat, it showcased genuine bipartisan collaboration on healthcare reform issues, where conservative and progressive populist critiques of the healthcare system align. The conversation revealed policy areas where Kennedy's iconoclastic approach might achieve meaningful results with congressional support. Blackburn's opening expressions of appreciation established a fundamentally different dynamic. Her praise for the Rural Health Transformation Program, area wage index reform, and Kennedy's commitment to ending conflicts of interest created a foundation of goodwill rare in congressional hearings. This approach, acknowledging areas of agreement before making requests, proved far more productive than the accusatory questioning that characterized other exchanges. Her focus on the pharmaceutical and food industry revolving door touched on one of Kennedy's core grievances and a concern shared across the political spectrum. The phenomenon she described, individuals moving between industry and regulatory positions, signing off on regulation for their former employer and many times their future employer, represents a structural conflict of interest that undermines public trust in health agencies. Kennedy's stated commitment to ending this practice aligns with both progressive concerns about regulatory capture and conservative skepticism of administrative state corruption. Blackburn's discussion of pharmacy benefit managers demonstrated how PBM reform has emerged as a rare issue of genuine bipartisan consensus. Her reference to legislation she developed with Senator Wyden, a progressive Democrat, that passed committee in the previous cycle shows the breadth of support for addressing PBM practices. The specific provisions she outlined, keeping rural pharmacies open, limiting PBM profits to standard service fees, requiring full pricing disclosure, address concrete harms rather than abstract ideological concerns. Kennedy's unequivocal, "Yes, Senator, absolutely," commitment to helping pass this legislation suggested he recognizes both the policy merit and political opportunity. The interoperability discussion revealed Kennedy's ambitious vision for healthcare data sharing alongside practical implementation challenges. His achievement in securing concrete commitments from the 60 top tech companies for data sharing, patient accessibility, and interoperability represents significant progress on an issue that has frustrated healthcare reformers for decades. However, Kennedy's admission that he couldn't explain how that's going to mesh with existing federal frameworks exposed the gap between aspiration and execution. Blackburn's request for a written pathway forward recognized that good intentions require detailed implementation plans. The discussion of overprescribing stimulant medications to children represented perhaps the strongest area of alignment between Blackburn's traditional conservative values around family and Kennedy's critique of pharmaceutical industry influence over medical practice. Kennedy's stark statistic, 1 out of every 5 kids on these drugs and the antidepressants, if accurate, represents a profound shift in how American society approaches childhood behavior and mental health. The question of whether this medicalization of childhood represents appropriate treatment or overdiagnosis driven by pharmaceutical marketing remains deeply contested. Blackburn's concern as a grandmother about children suffering harmful side effects added a personal dimension that transcended political positioning. Her emphasis on community-based intervention and better arming parents with information about risks suggested a preference for non-pharmaceutical approaches when appropriate, aligning with Kennedy's broader skepticism of medication-first treatment paradigms. This exchange demonstrated that beneath the vaccine wars and pandemic politics, substantial common ground exists between Kennedy and members of Congress on issues like regulatory capture, pharmaceutical industry practices, rural healthcare access, and concerns about childhood medication. The question is whether these areas of agreement can translate into actual policy achievements, or whether Kennedy's controversial positions on vaccines will prevent the coalition building necessary for legislative success.